Health Hawke's Bay is urging people to seek support if they need, as the flu-like respiratory virus, commonly known as RSV, puts hospital wards and general practices throughout New Zealand under pressure.
This story is made possible by the following sponsor.
RSV is actually a really common virus that affects children and some older adults with underlying health conditions. Though the name doesn't sound familiar to you right now, chances are you or your children have actually had this virus. So RSV is an intensely seasonal virus. We see spikes of it every winter. It circulates in our communities always and often comes back worse in winter. We didn't see it last year when we had everybody in lockdown and observing social distancing and hygiene measures. This year, with all of us back to normal pretty much, we're seeing it rise in our communities, and it has been very busy for our primary care and secondary care providers over the last few weeks. So it's like any other respiratory virus. You might notice a runny or congested nose, coughing, headache, fevers, or generally feeling unwell. In your small children, you might see that they're not eating and drinking as much as they normally would, and they might be a little bit lethargic or cry. Most important thing to do if you're sick is stay home. Keep yourself away from other people to prevent the spread of this or any other illness. Of course, public safety and hygiene measures are at the front of our minds at the moment with COVID, but remember, RSV is also something we need to be careful of. Keep a close eye on your children. Keep them warm, not too warm. Make sure that you observe for fever. If your child has a fever, you can treat that with paracetamol and ibuprofen in accordance with instructions from your doctor or pharmacist. Make sure that you encourage regular fluids and keep an eye to make sure your children are eating and drinking regularly. If you think that your children are not getting any better or getting worse, if you think that they're having difficulty breathing or have a persistent cough, please seek advice from your healthcare professional. Babies under the age of 2 are most susceptible to RSV, however some of our elderly patients who have other health conditions are also susceptible. Important to note that RSV spreads like lots of other viruses. It spreads through coughing and sneezing and not washing our hands as carefully as we should. So please make sure that you're not sharing cups, that you're covering and containing sneezes and coughs, and washing your hands as much as possible. Also important to recognise that having an unwell baby or person in your whānau does create extra stress and pressure. So if you or your whānau are feeling under pressure, please seek advice from your provider, whether that's your general healthcare provider, a Māori health provider, tai whenua, or your social services provider to make sure that you have all the support you need to care for your whānau. Please remember to seek help for your child are having difficulty breathing, a persistent cough, a fever over 39 degrees, are not eating and drinking well, or have a seizure with an immediate recovery.